like to express my thanks to the Egyptian Society of Nephrology and Transplantation for providing me with this platform to present my work. The association between non-alcoholic fatty liver disease and the risk of chronic kidney disease in Egyptian patients. This is the title of our work. First of all, I'd like to thank my teamwork in this paper, Professor Hiba Esem, Professor Hiba Ahmed Abdelati, and Dr. Azzat Mohammed Abdullah. My name is Ahmed Mokhtar, Assistant Lecturer of Internal Medicine at Nufay University. As all of us know, non-alcoholic fatty liver disease is one of the most frequent chronic liver disease and a global health problem. Also, chronic kidney disease is a leading cause of this. The global burden of CKD is increasing, and it has emerged as a major public health concern. But establishing a relationship between kidney and liver would help us to identify the kidney illness sooner and enable for selection of medicines that target both liver and kidney disease with potentially beneficial preventative and therapeutic implications. So now we want to target both kidney and liver. There is association between them or not, we will see. Aim of our work to measure the prevalence of chronic kidney disease in individuals with non-alcoholic fatty liver disease prevalence, and to compare the prevalence of chronic kidney disease in the NAFLD group and non-NAFLD group, and to assess the risk factors of chronic kidney disease in individuals with non-alcoholic fatty liver disease. Methodology, we design a study, analytical cross-sectional study done at Internal Medicine Department of Nufay University on 430 eligible patients divided in two groups, NAFLD group and non-NAFLD group by ultrasound. Each group contained 215 persons. At first, we exclude the individual with decompensated liver cirrhosis and active malignancy who refuse to join the study. Patient with a history of hepatitis B surface antigen positive or hepatitis C antibody positive, history of excess alcohol intake. Then we use these tools. First of all, we took a full medical history, socioeconomic, socio-demographic data, past history, diabetes or hypertension or current medication, anthropometric measurements, weight, height, and waist circumference, body mass index calculated, full lab, CBC, lipid profile, renal function tests, liver function test, LDH, and fasting blood sugar. Then we assess non-alcoholic fatty liver disease severity and or fibrosis by non-invasive measures, NAFLD fibrosis score and fibrosis 4 score. We diagnose every patient with CKD or not, and staging of CKD. Then diagnosis of metabolic syndrome for every person, presence or not. Let's show our result about this study. Concerning socio-demographic data and comorbidities, we found that the mean body mass index and the waist circumference of the NAFLD group were significantly higher than the non-NAFLD group. And the presence of diabetes, hypertension, metabolic syndrome, chronic kidney disease were significantly more present in NAFLD group than the non-NAFLD group. In this result, in general, we found that presence of chronic kidney disease present more in NAFLD group. Let's show more details. We found, according to this bar chart, displaying the difference between NAFLD group and non-NAFLD group concerning the chronic kidney disease status and the staging of chronic kidney disease. And we found that chronic kidney disease stage 1 to 2 is present more in NAFLD group than non-NAFLD group by 13% of NAFLD group has had chronic kidney disease stage 1 to 2 versus 6.5% in the non-NAFLD group. And we found also a significant difference between NAFLD and non-NAFLD group concerning stage 3 to 5 chronic kidney disease by 25.1% of NAFLD group had chronic kidney disease stage 3 to 5 versus 0.9% in the non-NAFLD group. So staging or more NAFLD and more staging of CKD. And this chart shows the prevalence of chronic kidney disease subject with non-NAFLD group and the NAFLD group, and according to a NAFLD fibrosis score, we found that the prevalence of chronic kidney disease increased significantly with the severity of NAFLD. The more severity of NAFLD and the more fibrosis score, we found that more staging of chronic kidney disease, not only presence of chronic kidney disease. According to concerning abnormal proteinuria, also we had a difference between NAFLD and non-NAFLD group. We have 24.7% of the NAFLD group had abnormal proteinuria versus only 7% in the non-NAFLD group had abnormal proteinuria. By binary logistic regression analysis, we found to detect the independent risk factor for NAFLD, we found that the presence of hypertension, chronic kidney disease, and the high level of basal metabolic rate and waist circumference were the independent risk factors for NAFLD. Each of them can cause or be risk factor for NAFLD group. And by logistic regression analysis for independent risk factor for CKD, also presence of NAFLD, diabetes, and elevated body mass index were the significant risk factor of CKD. By conclusion, we found that the presence and the severity of NAFLD are associated with an increased risk and the severity of chronic kidney disease. So we recommend that patients with NAFLD, especially those with coexisting comorbidities, should be regularly and carefully assessed for the risk of chronic kidney disease and proper treatment of obesity, hypertension, and diabetes in the NAFLD group and NAFLD patient to prevent the development of chronic kidney disease. Thank you.